how do you find that the typical APP MSSP participant, that is the APM Performance Pathway for Medicare Shared Savings Program, how does your service to those programs differ from the MIPS?
Yeah, that's a great question. So when we work with practice to report MIPS, we're working directly with the practice and sometimes directly with the provider themselves. When we're working with someone doing APP or APP Plus, for example, we're not working directly with the practice, we're working with the ACO. So the ACO entity has support staff. They have lots of folks who are very knowledgeable. And so our role at Mingle Health is to be that technical support to keep the ACO updated on regulatory changes or clarifications, to process their data and kind of address any technical issues that may be in place. But really, our role at Mingle Health is to support the ACO, who is in turn supporting their practices. There definitely are some times that an ACO might find, or maybe they know off the bat, that they don't have the staff or the expertise that would be needed to support the practices themselves. And we're definitely available to help if that's a need that the ACO has. But in general, what we find is that Mingle Health gets to be behind the scenes and really help the ACO be their best selves, help them to be knowledgeable and support their practices the best way possible, while we can kind of be the engine behind the scenes.
But then I'm to understand that if they find that's not the case, you can expand your service and reach out directly to the individual practices.
Absolutely. So one of the important things is that we're able to meet folks where they're at. So if the ACO starts working with us and thinks their need is one thing, but they discover other things, we can be flexible. We're happy to add additional support, additional services. We're happy to, rethink the way we work together if the needs change. And so we have a product in place to support that. We want to make sure that the ACO and the practices are successful. And what that looks like can be a little different for everyone.